Well, the truth about emergency rooms, the wait can be excruciating and it can be costly when it comes to immediate care. Modern Emergent Care knocks out that wait time and then gives you the attention you need as soon as you walk through the door. And I'm here today with Dr. Ray Gutierrez. Thank you for coming in.
Thank you.
Well, let's go ahead and start with the fact that you guys are able to get things done so quickly. So why is Modern Emergent Care so fast?
Well, there's two parts. One is the process improvement, and the other one is understanding the delays with the equipment. In the emergency room, what typically happens, you get seen, you register, you go to triage, you go back in the lobby, you go into a room, you see another nurse, you see the doc, he puts in orders, and then what winds up happening is you wait for the orders to get carried out, transported back to the location where the orders are carried out, and then everything comes back. At our facility, we've combined those steps into a lot fewer steps, and so we're able to be faster, easily by an hour.
Oh, wow. That is so in and out, really.
Right. And then the second part is the diagnostic equipment. We have a full comprehensive lab, and I'll talk a little bit more about that if you want. What we do in that scenario is we don't have to share our x-rays with the rest of the people in the hospital. We don't have to share our labs with anyone else. So if I order a test, they're ready to go for that test in the next 10 minutes. In the hospital, sometimes I'll order a test, and there's 14 people waiting in front of them, and they might have to wait 2 hours.
And then also explain the diagnostics that you have going on there, the different tests that people can come in and have done. Yeah.
Similar to outpatient diagnostic centers also, we have an outpatient laboratory center and outpatient digital imaging center. In our lab center, what's nice about us, and different than most other facilities, is that you can get most of your results done within 2 hours. So there's some tests we have to send out, it takes a couple days, but pretty much most of the blood tests can get done in 2 hours. The nice part about that, you don't have to wait for an appointment. You just show up and says, I'm here to get these tests and get them done. Our diagnostic center is also very nice. With the exception of MRIs and ultrasounds, you don't need an appointment. If you need CAT scans, x-rays, most of these tests you can get done right then and there without an appointment. Again, MRIs and ultrasounds are an exception. Most of the times you need an appointment, but sometimes we can do it right then and there. The nice part about us there, which separates us from most other facilities, is you don't have to wait. When you get them done, you have the results in 2 hours. And a lot of people appreciate that.
Yeah, that's what they love to hear. Now, one thing that you guys know, if you've had an emergency and you've gone to a regular emergency room, you end up with all these bills. It's expensive. It's kind of surprising, to say the least. You guys have transparent pricing, so tell me about that.
Well, the healthcare industry is the only industry that most of the times you don't know the price until a month or two later. And it's understandable for some parts, but think about going and buying a car and you find out a week later after you've had the car, or a month later, oh, your bill is this. This is how much the car costs. So people want better. People want to know, is this going to cost? So transparent pricing allows customers to make educated decisions. You say, well, I want a qualified physician. You find 2 qualified physicians. I want the resources available that I need. You find 2. And then you say, well, now what about the timing and what about the cost? And so with transparent pricings, the customers, the patients, can make better decisions. And we show our prices. We want you to compare our prices. After you look at the prices and you look at the services we provide, you wouldn't want to go anywhere else.
And then, Dr. Gutierrez, when it comes to the actual insurance, most people think that out-of-network would be more expensive than in-network, but that's not always the case.
If you have 2 guys, 2 facilities or 2 physicians that charge the same prices, then it's beneficial to be in-network than out-of-network. If there is a difference in price, then the question is, where do you make that decision? With us, because with the exception of Medicare, we're out of network with most insurance plans, and we do that for a reason. Because we're allowed to charge less money, and for most of our patients, especially with the high deductibles and patients who don't have insurance, we almost always save patients money. And you're talking about anywhere from $500 to $2,000 compared to the hospital emergency room.
All right, that's what we like to hear. Well, all that information and then more we're going to have posted to atlantapluggedin.com, so all you have to do is head over there to get everything you need for Modern Emergent Care.